So, let's pick up our little packet here and pull out the contact record. The contact record. Somewhere in there. You got that one? All right. Put it upside down. Take the NLC evaluation. Put it upside down on top of the other one. I think I may have given you two. Okay. ADHD environmental questionnaire. A sheet that says absolutely nothing except program services with a lot of lines on it. That one's next.
What's the one before that?
Before that was ADHD environmental questionnaire.
Then NLC tuition agreement. And then the Staples client disclosure agreement. Then the participation agreement. Then the consent to release information. Got it? Then the reading assessment, informal reading assessment. The submodalities checklist. Then let's do the block lettering, the script lettering, and the statement by Johann Wolfgang von Goethe.
She's helping.
Lots of help, huh?
Okay, so it goes contact record, NLC evaluation, the ADHD environmental questionnaire, the tuition agreement,
The program services. This one, after the ADHD questionnaire.
This
That
one?
right in there, yeah.
after the,
After the questionnaire, the ADHD questionnaire. Yeah. And then the tuition agreement.
okay,
And then your client disclosure
okay,
agreement.
got it.
Participation agreement.
Okay,
Consent to release.
okay,
Your informal reading assessment.
all right,
Then your submodalities checklist. You got those. And then your block letters.
okay,
You got your block there.
Yep.
Your script. And then you got it. You've got an evaluation form. Did you not have it in there?
yeah, I got it right here. Where does that go?
Okay. This is what it said. Oh, that's after the contact record. Second one.
Okay, second one.
Yeah.
Okay,
Thanks.
so let's put that in our folder, and we're not going to do anything with that right now. I don't think. Let's see which one of these.
This is a busy bee.
Yeah.
Okay. Yep, that's everything. So these forms are these are my forms that were created here. They don't represent any, any special, what's the word? Legal expertise or or medical expertise. It's just, these are things that I use to keep track of what I'm doing with a particular client, what I want the parents to agree to in working together. So obviously for your business, you should have anything you do checked out by a lawyer, blah, 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 doctor, medical, whatever it is that happens, it's not my fault.
Every aspect. With my other job, I had to take out insurance for that purpose in case someone comes back in.
Yes, and I do have insurance. I have E&O insurance, yes. And it will probably cover you for everything normal except for sexual abuse. Unless you pay some huge astronomical amount of money, you cannot get indemnified for sexually abusing children. And that's probably a good thing. That's, you can't, it's just my opinion, but yeah, they specifically state if you're accused of that, you are on your own. Your insurance company, they will represent you for all kinds of other. Somebody trips and falls. Somebody doesn't like your billing. Somebody doesn't like the way you said something or did something or worked with their kids. That's all covered. But yeah. Okay. So let's start out by just opening up our books to. Are we not ready yet?
Yeah, sorry. Trisha's asking what kind of insurance.
What's it called?
It's like E&O insurance,
Oh, okay.
like errors and omissions. It'll probably be combined with the general liability package, and what they'll want to see is like all your marketing materials, everything that you claim to be or claim to do. They're going to want to look at that and then decide if they can insure you for that. The funny thing was, every insurance company that the broker was looking to understood hypnosis, but none of them understood NLP. They didn't know what the heck NLP was. So, that bumped it up. But I mean, still, you're talking about $300 a year for your business. That's about what mine runs right now. And I will also tell you that within the first year of opening my doors, I got a letter from the State Board of Speech and Language Pathology, and they wanted to know because we're using the words autism, dyslexia, sensory integration disorder. They wanted to know if we were qualified to be treating those disorders. So I sent them all my materials, my disclosure agreement, which says clearly we're an alternative or complementary healthcare provider. That's what we are. And even given that, we don't actually treat anything. We don't cure autism, we don't cure ADD, we don't treat dyslexia. What we do is we teach children and teens and adults how to read, how to focus, how to memorize, how to do math. Some of them happen to have ADD, dyslexia, autism, whatever. So we don't refuse those clients. We are willing to accept them as clients, but it's not the ADD, dyslexia, autism that we are fixing. We are helping them to overcome the effects of or succeed in school despite, or learn how to read in spite of blah, 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 blah. Does that make sense? Mm-hmm. So it's a very, very important distinction. And yeah, I know there's people that say it in different ways. There are guys, the one Facebook group, they really walk a thin line they're selling like not medical, nutritional supplements or something like that. And the company, you know, they've had their attorneys check out all the literature so that they don't cross that line. They don't fall under the FDA by saying these nutritional supplements help ADD, or these nutritional supplements will cure this, you know, autism. But the people who are selling this stuff, they go way beyond what the company. I mean, you see it all the time, right? Oh, this is going to help your child's ADD, or this is going to help their autism. And you know, the truth is, you know, give them 1,000 units of vitamin C a day, and it'll help their autism. Okay? You know, I mean, almost any good nutrition or good balanced diet is going to help with ADD or autism. So to say that, you know, your products, you know, you have to use our products to help with ADD or autism, it's just like, man. So generally I stay out of those debates. I stay out of the debates about meds or non-meds. It's up to every parent. It's up to every family. It's a tough choice, no matter which way you're going to go. If you can find meds that'll work as an interim measure, you know, to help you, to give your kid a little space and help them just like not be so out there at school while you're doing these other skills, while you're building these other skills. Personally, I think that's awesome. You know, as an end unto itself, I personally think you might be doing the child a disservice. But I never, ever, 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 ever recommend to a parent one way or another that they do meds or non-meds. The one thing that I do say is that if you have a child on medication and he's doing his cross crawls every day, and he's doing his focusing and his juggling and the other exercises every day, you may find that some parents have found that their children don't need the same dosage after a while, that they can actually cut down on their meds. This is purely just anecdotal, and it's going to occur differently for every family and every child. But we have had kids here that did get off of their meds, and because that was a goal of the parents. Does that make sense? It wasn't my goal. I had nothing to do with it. Yes, nothing to do with it. So, but I mean, I joke around it, but it really is serious. Because if you get the state consumer protection agency, if they come after you, man, if you get them mad at you, they will come with all barrels. And you know, they may not have enough money to give people at school, but boy, they'll have enough money to come after your ass. So be really clear and upfront and straightforward about what we do and what we don't do. Okay. So let's look back over those 24 skills really quick here. And anybody have any questions on those? If we run down the list. Actually, first of all, wait, I'm sorry, let me back up even further. Does everybody feel like, at least as a beginning, as a starting place, they can begin to have a child walk into their classroom or office or whatever you want to call your center or what you do, or walk up or come to their house? Do you feel like you can get some basic information on the child and begin to see the world from their perspective, begin to appreciate how they're experiencing the world in that visual, spatial, boom, 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 very fast moving, outside the box, kind of a Thomas Edison way of being, Walt Disney way of being with the world? Does that make sense? Because that's critical. That's critical. All the skills, all these techniques by themselves, they're really, in my opinion, they're not going to get you a lot. I mean, I appreciate what I do. What I'm saying is that by blindly throwing techniques out at kids it's not going to help. It's really, you're just going to drive them crazy. You're going to be like everyone else there that's trying to get them to change or be something they're not. You know, we were talking earlier. You know, what you're probably noticing as, you know, look at this whole 3 days or 2.5 days or whatever, 24 basic skills. Okay, you know how many skills are in this book? How many techniques? I mean, you could start when a child is 7 and keep trying different things until they're 14 and never cover everything in this book. And that's just for ADD. Like, to teach kids with ADD. If they're also having struggling with reading and or dyslexia, now you've got another whole book. And you could start going through all these techniques. Well, here's Thomas Hartman, which is probably closest to our stuff. He's got some techniques, which I think anything you read by Tom Hartman is good. Here's more on learning styles. It's Teaching Through Modality Strengths by Barbie and Swassing. You know, are you writing?
Tom Hartman, I was just going to write him down.
Oh, yeah, that's a good one to write down. And if you already have, does everybody have a copy of the Gifted Not Broken book? Everybody's got a good hard copy of that? Okay. That one, yeah. Almost all the references that I mentioned, the good stuff, is already in there. And then there's just stuff in there. I wouldn't necessarily assume just because it's a reference that it's a good reference, because there's stuff in there that I've, maybe there's something, a few lines from one book, or maybe I'm actually disputing the book. So, but Barbie and Swassing, it's got some really good stuff on understanding the difference between multimodal instruction, where you just kind of load up your shotgun with a little bit of everything and spray it around the room, and actually teaching through specific modalities, and I don't, I'm trying to think if they get into submodalities in here. I don't remember now. But it's really funny. I mean, this stuff's been around since the 60s, where they're looking at, how kids learn, and then, I don't know, it's interesting. Paul Dennison, EK, Educational Kinesiology for Kids. You can buy his stuff online. I don't know that there's anything that you shouldn't use of his if you want to incorporate it. I've stayed with some of the more generic activities that almost anyone can do. I've customized them so that parents and kids can work together and still get a really good result. There's a lot more sophisticated stuff. There's a teacher's manual you can buy. I use some of those techniques in the office, but I don't teach them to parents. Does that make sense? What I want to give parents is something that they can take and use at home right off the bat. They don't need a week's worth of training. Again, Tom Hartman. I would recommend that just about everybody and parents, if you have someone who's autism spectrum, I would recommend this book, Thinking in Pictures. This is by Temple Grandin. This is going to be, I don't know what her second book is like. I haven't read it, but this one is really written from the perspective of someone with autism. And I think it really helps you get a feel for how they think and relate to the world, and what stuff is kind of going to freak them out, and why it freaks them out. Why sudden noises? Boom. Why a sudden touch? Different things like that. So that's an awesome one. The best book by Tom Hartman that I would strongly recommend, and I don't see it here, is The Edison Gene. the Edison gene, ADHD and the gift of the hunter child. Don't seem to have a copy of that, right? Most of the books on ADD or ADHD, you know, and these are a little bit old because they still call it ADD, driven to distraction. I don't really like it. You know, it's got a test, kind of a self-test for ADD. But other than that, the basic premise of the book is live with it. You know, get your meds and live with it. I have not read Dr. Amen's newer book. This is an older one, Healing ADD. I think some of his program is it's a little cumbersome and a little difficult for average folks to implement. I agree with a lot of it. I think that in his next book, he's come out more in favor of like alternative approaches. He's the guy that's done like 10,000, 12,000 brain scans. And he can actually spot the kind of ADD or ADHD by looking at their brain scan. Okay? Now remember what a brain scan is. It's not about the ability of the brain to function or the size of the brain or the blood flow. It's not like an MRI that shows injury or damage. The EEG shows activity at a given moment under a given set of circumstances. So you take a kid that's sympathetic dominant, right? And you bring him to this big giant hospital and you strap him down into a chair and wire him up. Oh, maybe he'll be a little bit nervous. Maybe. Yeah. So going back a ways, I remember reading in his older books, you know, that mostly what you could do was medicate the child to change the brain scan and then use hopefully some behavior modification. Well, he's since come out and said meditation, hypnosis. I can't remember if he specifically mentioned hypnosis, but basically said there's lots of exercise, mind-body things that you can do that will also change the brain scan. So it's very cool. I'm really excited about that because he's about as well known as anyone in the field. So if he says that you don't necessarily need meds to change that brain scan, that you can change the chemistry of the brain changes what you think, and if you change what you think, you change the chemistry of the brain. That's pretty cool. So the bag of tricks we have, the bag of tricks that we've taken from hundreds of thousands of pages and pages, and there's a lot of stuff that I do that's similar, somewhat similar to the gift of dyslexia. You'll see Ron Davis. He has a very different way of doing his focusing thing, but it's basically staring at a dot. It's getting the child out of the sympathetic nervous system so that they can hold that image steady. It's taking, either with clay or Play-Doh or whatever, building that library, that visual spatial library of those letters in the brain. I don't really know what he does for handwriting, but because his foundation is based on that disorientation rather than some neurological disorder, you know, that would require like an occupational therapy or like a, you know, some neuromuscular disorder, which again, I would be the first one to say if a client came in, that's way outside of our area of practice or expertise. So what I'm guessing is they don't deal with that either at the Davis Center. What they do deal with is this perception, this process. I know he doesn't describe it like that, but basically the process of drawing, painstakingly drawing each letter, so that if you try to rush it all, you know, it just becomes nonsense, because your drawing brain can't work that fast. But when you move it to a different strategy, so that it is basically just it's just automatic. It's just an automatic process. Now you can without spending an inordinate amount of painstaking time, you can get a nice letter, a D each time. So that's that little trick that we have, which is you draw the letter 3 times, and then you close your eyes and draw it again. And you're drawing it from your visual memory, from that visual map that you have. Okay. So, anything else we talked about in those first 2 days, you know, understanding the child's perspective, standing in their shoes, looking at their behavior from the intention, you know, not the other way around. We usually look at the behavior and judge the intention. And they usually have nothing. They often have nothing to do with each other. So, questions?
I'm really comfortable with it.
You got it?
Yeah.
Awesome. Good.
On that spelling strategy,
Mm-hmm.
when they, I just want to get the order in. So when they hold it up there, they look at, you know, before they even do anything, they create a picture in their head of the word. Is that right? And then you hold it up.
Of the meaning or content of the word. Does that make sense?
Whatever it is to them, or you don't tell them what kind of picture, they come up with something?
Most often in the beginning, before a child has developed this strategy, and that's a big wild card when you're working with different students. Okay, you may show this to one student and they'll get it the very first time, and you may do this for 90 days with another student, and then it will click. So this is why you have to have parents here at your sessions, because a lot of these techniques for the younger kids, the parents were the ones that are really learning the technique, and they're gonna work with the kids for the first 90 days. A child, a 7-year-old, is not going to remember a 10-step program for memorizing spelling words. It's not going to happen. So the parent is the one that's actually going to implement those 10 steps. They're going to give the child the word in a sentence, okay? And you know, make sure that the child understands what that is, what the concept or the meaning is, and the child's going to visualize it. They're probably going to remind them to make it silly or funny. And I'll probably do this once or twice again. I let you guys do it amongst yourselves, but I should probably do it once just so you can see how I do it. Of course, you've already seen a couple times, but yeah, so it really is the parent or guide or coach who's going to, in the beginning, give them the picture, give them the sentence, help them make it funny, remind them to make it colorful and bright, and then...
So they get instructions, because as one of those people who sees all these possibilities, when I say someone says, well, make a picture of the word, it's like, it's almost overwhelming, because, you know, do I do it this way, do I do it this way, do I do it the way I think you think I should do it, or the way I think I should do it, or the way...
See, that understanding is invaluable. That understanding is invaluable when you're working with a kid who's an outside-the-box thinker. See, so you get that. You already get that he can go in 20,000 different directions at any given moment. So that's awesome. Yeah, very good.
So at first you kind of give him directions on a picture.
Mm-hmm. And you'll know if he's not catching on, then you stay with him. You stay with him. You stay with him. Most kids, after about 90 days, whatever you're doing for 90 days, it becomes a habit. It becomes a habit. Something that you often see when you're teaching the new reading strategy is you'll actually see, here's 0, 4, 8, 12 weeks. So the child may be here to start with, and they may go down as they're struggling with reading in this new way, giving up the sounds, giving up the phonics, and seeing, so they may actually slow down or struggle a little bit in that first, couple of weeks, right, somewhere right in here, and then what you often see is something like this. That's what it looks like. That's what it looks like. The funny thing is right about the time that they do, it's around 1,000 words. By the time you've done 1,000 spelling words, see the word, make a picture. See the word, make a picture. And if you rehearse it within an hour, day, and a week, that's times 4. So basically, by the time you've done 250 words, and you've rehearsed them all 3 times, that's about 1,000 times. See the word, make a picture. See the word, make a picture. See the word, make a picture. And right about that time, that's when their reading will often take off. And you'll see this shift where it's like it's like an automatic thing. The most profound example I saw was with Allie, who we started in the summertime, so she didn't have her 20 words a week. They were just working off the sight word list. And we were about 10 weeks into the program, and her reading still wasn't clicking. And when it gets to that, even I'm like, oh gosh, what did I miss? I'm starting to get worried. Or starting to, think of, is there something I should do, something I didn't catch. But at 10 weeks, she came in with her dad, and they were both like beaming ear to ear. And so the story they told me was that the day before, they sat down to make lunch. They went to make lunch. So they pulled everything out of the refrigerator, the bread, the ham, the mayonnaise and relish and whatever else they were going to put on the sandwich, lettuce and tomato, whatever. And they made their sandwiches. They put everything back in the refrigerator. They sat down, and as she's taking a bite of her sandwich, she goes, "Dad, I can spell mayonnaise." Now, did she look at the jar of mayonnaise and think, "Ooh, mayonnaise. Mayonnaise, I like mayonnaise on my sandwich. M-A-Y-O-I, blah, blah, blah," right? Did she do that? No. The brain unconsciously saw a word and took a picture of it. That was it. And she could sat there. I haven't rehearsed it, so I can't do it off the top of my head. But she could spell mayonnaise forwards and backwards. It was very cool. Very cool. So, yeah, you'll notice things happen as the brain latches onto a new strategy and says, "Ooh, I like this." And then the other thing you'll see that I saw with like Spencer, somewhere around, good old Spencer. What is that he's got in his hand?
It looked like candy, but
Somebody asked me about that.
yeah. No,
Maybe it is
maybe I
candy.
was D.
I don't know. He's happy though. He's more than happy. But he was the one that within the first 3 months of working together and teaching some new skills, especially related to cognitive thinking, decision making, boy, he took that and his brain generalized that into like 5 different areas of his life. It was really amazing. and he started seeing changes way outside of the academic realm, because he had generalized some of those strategies. Very, very cool, very powerful. Did I spend enough time on homework? If not, we can touch on that later too, because that's a huge issue for some kids, is getting a recipe down for homework.
I have a question.
Mhm.
If my son comes across a word that he doesn't know,
Mhm.
usually teachers say, sound it out, sound it out.
Right.
I should tell teacher, no, you tell it to him what it is, so he doesn't sound it out.
Yeah, it's tough. Teachers have their way of doing things, and they want to do it the same way for the whole class. They want to keep it consistent. They want to give everybody the same test. They want to give everybody the same study materials. They want everybody to read and write and study the same way. Convincing them that that's not appropriate is a really tough, it can be a tough battle. I mean, it goes against their training,
Yeah,
in a way.
this teacher's very cooperative.
Well, then I would go for it. I would go for it. You know, remember, the best way to do it is actually to go over the words, the vocabulary words, before you read. So you have all the words in your pocket. Because ideally, the process you want to get into when you read is see the word, add your picture, see the word, move your picture, see the word. And it's like a movie. And all you're doing is you're looking at each word, and as the word triggers the meaning, you just add that to your movie up here. You just add it to your movie.
Well, should I read it first and then see and then know those words that he can do? I should be the one that pick it out.
That's awesome. That's the ultimate. That's best right there. Yeah.
He probably, you know.
That's why when kids are really practicing and learning, I usually recommend that they read below their grade level. Now that's going to be just the opposite of what you're going to hear almost any other teacher say. You want to read slightly above your grade level. Okay? Once you're reading for content and style and flair, then yes, read whatever you know, read Shakespeare, read Jack London or you know, Mark Twain or whatever it is. Read for style and content and all that. But when you're reading to learn, the process you want is a process of recognition. You want to see the word and recognize it. 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 Okay? And that process is it's consistent with the relaxed, focused, left brain, right brain, talking to each other, right? That state of mind that we just spent 5 minutes getting the child into with cross crawls and focusing and relaxed breathing. And now we're going to go and we're going to see the word imagine. See the word imagine. In fact, sometimes I don't call it reading, I call it imaginating. Okay? I just say, we're not going to read anymore. Because that like brings up all kinds of negative stuff, right? So I just say, we're not reading. No more reading. What I would like to do is practice imaginating. And we're going to look at words and imagine what they mean. Okay? So we want a process that's appropriate to relaxed, focused imaginating. Now the other kids, the left-brainers, they're fine. You couldn't stress them out with a bullwhip and a air horn. Okay? They're just laid back. So you can say, now decode this word and sound it out. And then this word, sound it out and go into that decoding mode and be the detective and they need to think. They need to think more. It's good for them.